Okay, now it's a beta blockers. So there are some classification we use to classify the beta blocking drugs. So these section of drugs is very important. First one is cardioselective. These are beta 1 blockers. Mnemonic is new beta blockers act exclusively at myocardium. New means nebivolol, beta means bitexolol, blockers mean bisoprolol, active means atenolol, exclusively mean esmolol, at means esbutalol, myocardium means metoprolol. So these drugs prepared patients with diabetic mellitus, bronchial asthma, hyperlipidemia because they are beta 1 selective. In bronchial asthma, we know if these beta blockers block beta 2 as well, it will cause bronchoconstriction. So we can't use these drugs in those patients. So beta blockers mainly used in hypertension. So that is the main indication. So if you use cardioselective beta 1 blockers, it is more good in with these patients like in diabetes mellitus, bronchial asthma, hyperlipidemia, bronchial asthma mainly. So beta blockers with intrinsic sympathetic activity. So this is actually mnemonic is contain partial agonist activity. Also it describe what is ISA. ISA intrinsic sympathetic activity. It means uh, this is not a beta blocker that completely block the sympathetic activity, because some patients have prone to develop severe bradycardia. So we do not need those patients to develop severe bradycardia. So these drugs are not potent as these cardioselective beta blockers. These partially activate this beta blocking activity. So that's what it means. So mnemonic also it describe what is ISA. It is contain partial agonist activity. So contain means celiprolol, oxyprenolol. Partial means pindolol. Agonist means alprenolol. Activity means S-butyl. So if you suspect this patient could develop severe bradycardia due to beta blockers, you could use these beta blockers with ISA. Next, beta blockers with membrane stabilizing activity. So these beta blockers mainly we use as antiarrhythmic medication. Mnemonic is possess membrane stabilizing or local anesthetic property. Possess means propranolol. Membrane means metoprolol. Local means labetalol. Anesthetic means desbutalol. Property means pindolol. So when we are talking about antiarrhythmic medication, the main beta blockers that we use is these beta blockers. So we will do another section in antiarrhythmic drugs. So in antiarrhythmic drugs also we talk about this drug. So that's why these beta blockers are specially used in antiarrhythmic medication, because these beta blockers has membrane stabilizing or local anesthetic properties. Next, the lipid insoluble beta blockers. So lipid insoluble means these beta blockers has long duration of action, and uh, necessary to remember that we should avoid these drugs in renal failure. So mnemonic is not soluble ABC. Not means nadolol. Soluble means sotalolol. A means atenolol. A is butalol. B means bitexolol, bisoprolol. C means celiprolol. And when we see a drug that we have to identify this is a beta blocker, so we identify it as a olol. So every drugs that you see is a metoprolol, propranolol, labetalol, esbutalol, pindolol, olol. They have olol in the ending, olol. So if you see a drug, it is ending is olol. It is a nothing but beta blocker. So main indications for beta blockers is mnemonic is 3A. First one is angina pectoris, A antiarrhythmic. Um, Third one is arterial hypertension. Why we use in angina pectoris? Beta blockers actually decrease the heart rate, so it decrease the work of the heart. So if patient having anginal pain, we could use beta blockers to decrease the work of the heart, and demand decreases. So in angina, supply decreases, no, demand increases. It's imbalance in myocardium. So we use beta blockers to decrease demand. So when heart rate is decreasing, the work of the heart also decreasing. So demand will be less. And antiarrhythmic medication we use because they have membrane stabilizing activity. And arterial hypertension as well. When we talk about arterial hypertensive drugs, we'll talk about beta blockers more. Main side effect is BBB, BBBC. So B means bradycardia, B means bronchoconstriction. So if a patient having bronchoconstriction and is there's a prone to have bronchial asthma, so you could use beta 1 selective ones, no? So in beta 1 selective beta blockers, there's no side effects such as bronchial asthma because it's beta 1 selective. But beta 1 and beta 2 you can't use. So we have to remember B pro bradycardia, B bronchoconstriction, and bad dreams, and cold extremities, and arterial hypertension as well. So those are the mnemonic and this side effect BBB, BBC. So remember, the beta blockers are mainly used in angina pectoris, antiarrhythmic, and arterial hypertension. All mnemonic are there, and they ending with olol. Olol.